military. What I'd like to do, everybody that has been here from the start, could you please stand up? Can everybody come around the doors? Thank you so much for your dedication. Can I ask you to actually stand down towards the main doors? And then we're going to start a line from those that have been here the longest to those that have been here next time. So those that have been here, yes, from the beginning. The lighters. Okay. Right. Been part of MIQ for 9 to 12 months. Can you please join the queue? Those that have been here for 6 to 9 months, please join the line. I need you to line, so I need to number you off to put you in groups. So no one has a number. And those that remain, please. Single file, please. Single file. No straight line. All right, so I'm going, everybody listening? Okay, I'm going to number you off 1 to 7, and then all the ones need to get together in a group, all the 2s, etc., etc. Okay. With the challenge, remember your number.
It's a Friday test.
Wonderful. Okay, please find your groups. This is latest.
So what we're going to do now is we've got a whole lot of events that happened in our long timeline, and we've obviously mixed them up, and hopefully we've got a mix of experience in each group as well. So Mel and I will just come through and give you your events to then sit onto the timeline. So.
But I think Oh, they would have been last year.
That's good.
Once you're finished, you can go down and sit at the table, maybe with your parents or probably your intimacy.
Anybody else that's saying that you want to
Alright, so the consistent maybe you should sit in your few groups, get you moving around. Back to section your group. I feel like taking water again. Anybody else? Right, thank you for that. The exercise we just did, hopefully, helped your memories of some of the important events in our timeline. Some events that maybe didn't seem so long ago, but you just realised they were, 8 or 9 months, or the other way around, when it felt like yesterday. How many of you remember that it wasn't until May that we were allowed returnees compassionate exemptions, or that it wasn't until the end of June that returnees were allowed to and were required to wear masks outside of their room?
Well, two groups got it right.
Or that in July, staff testing was only voluntary, and that the first release of our operations framework wasn't until August. We encourage you to have a look at the timeline over the break and reminisce for the trip down memory lane for something. We picked out obviously some cities and things. You can add any other events that you remember, or maybe note when MIQ became part of your life. You can also have discussions about whether they're placed in the right months. We do have a master sheet here if you wanted to check any of them, or just Google, which is what Mel and I spent a bit of time doing. Things in MIQ have evolved considerably since the early days when we were essentially figuring out what we were doing as we went along and having to respond very swiftly to changes that were announced at the 1 PM stand-ups. For those that don't know, I was working up in the Auckland Brick for the first 4 months for citizens, and I find it really amazing to look back on all the improvements that we've made into the slick operation that we've got running now. We've got the operations framework and all the SOPs. So Mel and I wanted to talk a little bit now about how far we've come in terms of improving some of the MIQ processes, and just thought we'd start off by relaying a few stories of how things happened in the good old days up in Auckland. So I just wanted to first talk about the air transfer process. So if we think now to our fairly smooth running of the air transfer process, this is where flights are nominated up to about 6 weeks out as being potentially suitable for transfer down to Auckland down to Christchurch or Wellington. The flights are locked in about a week or so in advance, and then passengers are given snack packs when they arrive. And you've also recently introduced the capacity to transfer flights other than Air New Zealand flights. The very first transfer we had down to Christchurch was due to the lack of capacity starting here in Auckland. It took a significant amount of planning, and believe it or not, the first couple of flights transferred to Christchurch were people who wanted to be in Christchurch, no matter what part of their isolation state they were in. Well, they were separated in different parts of the plane, which was kind of slightly unusual. We then had a couple of Indian repatriation flights go directly to Christchurch, again due to capacity issues in Auckland. I remember one Saturday afternoon there was a massive panic at the ABRIC when late in the day we found out that the flight that was due to be going directly to Christchurch and landing around midnight may have to be redirected to Auckland due to the fog in Christchurch. At that time we had very little capacity and had to come up with a fairly dodgy plan B, which involved using about 10 different hotels and not trying to think too much about what would happen later in the week. I also had to bring my husband, who's a pilot, to ask him to look at the weather patterns to see how likely the fog was. And I just really just kept my fingers crossed, and thankfully it didn't. The other thing that we had improved on is how we look after our returnees who are on these transport flights. By these days they get a nice little snack pack. We had an incident fairly early on where we found that there would be a delay in transferring a flight that had arrived from Korea. We realised we didn't have any food for these returnees. I can see everyone laughing. We didn't have any food for these returnees. And so one of our colleagues at the ARIC went out to a central Auckland Korean supermarket, got a couple of large trolleys worth of food, and then dropped it off to someone who would take it to the airport to ensure that these returnees would not be hungry during the long delay. I'm thankful that process has figured itself out a little bit more now, and that we hopefully haven't had too many more hungry returnees. So those first few months were a bit of a crazy time, but one of the amazing things of working as part of that team, multi-agency team, where you often really didn't know who was in which agency, you were all just focused on the common goal, which I think we've talked a little bit about today. It would be remiss to talk about the evolution of MIQ without mentioning the changes we've made to IPC. As Dr. Bloomfield mentioned yesterday, if we're still doing what we were doing a year ago, we'd be in trouble. So the evolution of our IPC knowledge has seen a number of changes in facilities made over the last year. Probably most visible is in the PPE used by staff and returnees. These days we're all used to returnees and staff wearing masks, however there was a time when no one was wearing masks. At the end of June, I'm not sure if anyone got this right, but following a bit of a surprise announcement from Dr. Bloomfield at the 1 PM stand-up, all returnees were then required to wear masks anytime they were outside of their room. I still remember sitting there and watching our nurse manager sitting at her desk following the announcement with her calculator out, trying to figure out how many masks she would need to get through the next couple of days to distribute to allow all the returnees to have masks when they got out of the room. And she went very white. Is that the right number of zeros kind of thing? And then we've had changes for staff PPE as well, including the decision to have all health staff fitted with N95, which required a huge amount of work from our DHBs to get that into place. So I'm now going to hand it over to Mel, who is going to further talk about some of the systems and processes we've changed.
Awesome, thanks. So I haven't been here as long as Anthea, but feel free to move if you want to see what I'm doing over here. The example I'm going to use is workforce testing, and it's been quite topical lately, and it's getting a lot of focus at the moment. And so Anthea sort of alluded to it. So if we start from, March, our lockdown, no workforce testing, April, no workforce testing, May, no workforce testing, June, and in July, we thought, you know what, if the staff want a test, they can get a test. So it's an opt-in. So it took us a number of months, and I say us, New Zealand, the scientific community, the health community, everybody, to realise that perhaps it's a good idea. So in July 2020, it was opt-in, not compulsory. We moved to August, and we had the August cluster, which prompted an initial COVID-19 public health response, workforce testing, or required testing, a one-off test. In September is when the fun started with regard to workforce testing, and we had the first and some amendments to the required testing order. This is when routine testing became mandatory. A few other things happened in here. Right, we had some manual sign-in systems established at the MIQs. So you would write your name and any other details that you chose to at that time, you chose to provide. And we had some workforce coordinator positions to help with the administration of this particular task. We move on to October. And we have this thing called BWTR. The Border Worker Testing Register. An electronic system was piloted in Wellington, and of course, with any new system, some limitations were identified. We moved to November 2020, and we had an amendment to the order where an individual's date of birth was mandatory because people just weren't providing it, which was, of course, as you all know and have experienced, was causing issues. At the same time, who's on location? In fact, I should just take a step back. The BWTR, which is a Ministry of Health run system, was piloted, and then the following month, the Who's on Location MB run system was piloted at 4 different MIFs. And the aim was, in the future, that BWTR and Who's on Location would sync seamlessly.
Still the aspiration.
Can you spell sync?
Okay, and then we get to December 2020, and there was a lot of political pressure to actually begin the use of BWTR, despite the knowledge that there was a lot of dirty data. Quite like that term. All right, in January, Who's on Location was implemented across all the MIFs, 32 of them. There were still some issues with that too. You can see a train smash coming, can't we? In February, a few weeks after Who's on Location had been rolled out across MIQ and all the MIFs, the MIQ leadership requested the first report. Now, those in the know were quite worried about the result of that report because they knew about the dirty data, the troublesome synchronisation between BWTR and Who's on Location. And as a result, that report basically provided some very worrying statistics. And as any leadership team would, they required a bit of a deep dive into it. There were some, I've turned them into agency discussions on BWTR and Who's on Location data sharing. So I wasn't in the room, I didn't read the emails, but as a result, we did a bit of a deep dive into some of the issues between the systems and how we can fix them. There was also some recruitment to actually really put some effort, some resource into this area in terms of the recruitment of personnel. And then we get to March, so not too long ago, this deep dive happened, a bit of a report was written, and we had a project manager appointed to really lead this team. We had additional analysts come in, and there was the recruitment for a team leader. So the workforce testing team was actually established as a functional team within MIQ. Okay, this was a mistake. Okay, and then we get to April. We've come so far. We thought things were going so well, and then we get to April. And bless them, human factors acknowledged, an Auckland security guard tested positive. And he tested positive as a result of another issue, incursion, mistake, fault, whatever you want to call it, whereby we needed to do a review of all of those personnel that had been in that facility. And as a result, we found out that there were some people that hadn't been tested, or we thought hadn't been tested. Well, this guy hadn't. He got tested, he was found positive the same day, and then we realised he hadn't been tested since
November.
Yeah. So a whole lot of other actions have occurred, and I won't turn those over, I'll turn those over in a minute. But suffice to say, you know, this is just one example. I'll go back to so everyone can see me. This is just one example of a system and a process that has evolved as a result of learnings in science and health, from people on the ground, from understanding what our people want, what our people should be entitled to. And, you know, you can see that right at the start there's nothing. We evolved to, okay, you can have a test if you want, through to, okay, now it's mandatory, through to having some systems and processes wrapped around that. Are we there yet? No. But are we a long way further than where we were? Yes. So, you know, despite the fact that there are still issues, in this and many other systems and processes. We've come a really long way in about 8 months from when that order was came into effect in September. So it's really important for us to sometimes take that breather, take a bit of time to reflect on how far we've come. And that doesn't mean resting on our laurels, because we are all here, every day working on how to make things better. And I think it's a fantastic opportunity that the leadership team have actually provided us to get together to reflect, because time is precious. And we've got such rich experience, knowledge and diversity in this room that we're going to get so much fantastic information, thoughts and ideas as a result of this. And I'm really excited to see where MIQ is in 12 months' time. So anyway, I quite liked, it was Ashley yesterday who talked about the F-bomb. I quite like that term, and we can all acknowledge that many mistakes have been made, but the most important thing that's been reiterated is that we've got to learn from them. We've got to put in place a culture, and I had actually written this before I knew about the culture workshop, but it's our job to create a culture whereby when mistakes are made, or when mistakes are nearly made, that they can be reported, they can be investigated, they can, maybe that's the wrong term, because that makes it run away, but they can be reviewed so that we can set in place those risk mitigations, different processes. We can consider all the holes in our Swiss cheese in order to reduce the impact of the human factors that will occur. And we've got humans in our system, and I thank Caro for explaining so fantastically the fact that so long as we've got humans, we will make mistakes, but it's not just all on us as a human. There is so much more to it. So anyway, I hope that this has been, just something a wee bit different to allow you to look back on where we've come from, to reminisce a little, to have a bit of a laugh, and to think, oh my goodness, really, isolation wasn't even compulsory at the start. How did that even happen? So we've come a long way, and thanks so much for your participation. It's lunchtime now, and we're going to come back at 1 o'clock. I'm just looking at Ted, who's nodding. So you've got, just under an hour to have a look. If you've got any other examples, please write them up, share your stories. So many people here have got